good evening, and welcome to this show again. Welcome to Innovative Dentistry. As you know, we come into your homes every evening at 6:30. Whether you're at home, at work, or even if you're driving, you can just plug this into your auxiliary cable and listen to us. You don't have to look at the show because we've been talking about some information and some important things about dental care and oral hygiene. Tonight is, as usual, it's going to be an interesting topic. We're coming to you live from TBN Studios right here in Queenstown, Georgetown. And this program is coming to you compliments of Innovative Dental Care. Innovative Dental Care is your friendly dental office where you can have everything done from cleaning to implants. So that joining me again tonight in studio is Dr. Pico, and he, as usual, would have all the information that you will need on what we're going to be discussing and other topics also. If you have information or if you have questions, sorry, and you want to have those questions answered, you can send it in, and probably in the last 15 minutes of the program, we will be answering your questions. So let me say goodnight to Dr. Pico.
Hello,
Dr.
sir.
Pico,
Good night, sir.
welcome, sir. Welcome again. Always a
Thank you
pleasure
so
to
much.
have you here. How have you been?
So far, so good. So far, so good.
Well, that's a good thing.
What about you?
Every time I ask you how far you've been doing, how well you've been doing, you keep saying so far so good, and I hope it keeps getting better for you.
Yes. It's going like that.
My week has been busy. It's a lot, and but we're here, and because our role is to bring information to the public and to let the public have at their access the information that they really need to know about various things in life. But in this case, we're talking about oral health and oral hygiene. So, what are we talking about tonight?
So tonight we will be talking about gum diseases.
Gum disease.
Yes, which is the second more common type of disease, or even sometimes we can say that the first more common type of disease related to the mouth after the cavities, the cavity decay. So
Okay.
it's a very important topic, despite maybe the public don't really know too much about this type of diseases.
Can gum disease affect even toddlers? At what age does gum disease start affecting people?
The gum disease is a general it's a wide variety of disease, gum disease. But the type of disease that we will be talking about today, particularly, is the periodontal disease, which is including the gum disease by itself, and also the disease that are affecting as a consequence the bone and the insertion of the tooth in that bone. So in that case, you call that general disease like periodontal disease.
Wow, wow. I want to say goodnight to Vinita Prasad from joining all of us from Alberta, Canada, and Mohammed Imran Shahrukh. Thanks for joining us. When I was going to school, I remember there was a post on the wall and it said, for you to prevent scurvy, and it had in brackets, I can remember clearly, bleeding of the gums, use oranges and cherries and things with vitamin C. Scurvy, I know it's related to bleeding of the gums, and they say vitamin C helps with that. Are you familiar with that?
Oh, okay, yes. So scurvy is not a gum disease. The bleeding gums that appear once the person is suffering scurvy is a consequence of the systemic consequence of the deficiency of vitamin C. So scurvy is not a gum disease, but the bleeding that is coming with the this type of condition it's not a gum disease.
Okay.
So it's just a consequence of what is going on once you have this type of conditions, deficiency of vitamin C.
Okay. So, all right, let's get into it then. This particular disease that we're going to be talking about tonight. What is the genesis of it? How does it begin in the mouth, and what are the causes? And obviously, we're going to get down to how we're going to solve this problem.
So yes, the gum disease is a group of diseases that are damaging, as I say, the gum first, and also later the periodontum, which is periodontum is the whole set of structures that are keeping our teeth in place. So we need to go back a little bit into our programs at the beginning, in which remember the public that is following
Platform.
this platform, this channel, they can recall that we talk about the biofilm, the dental plaque.
Yes.
Yes, in that time we show pictures about how many bacteria are living in that dental plaque, and that these bacteria are part of our um, normal set of bacteria that are living in our mouth that we need to keep under control by having practicing good oral hygiene and so. And when we don't practice good oral hygiene and we allow those bacteria to grow um, without control, because we are keeping our teeth not clean, that dental plaque will grow, and as a consequence, we are providing to those bacteria the food that will uh, allow them to grow, or when we are having some kind of condition, stress, and so on, these bacteria can overgrow, and as a consequence, the first um, sign that will show is the inflammation of the gum, because of course these bacteria during the process of using the carbohydrates that are the main structure of this biofilm, the biofilm or dental plaque, which is, as our viewers can recall, when we eat mostly carbohydrates,
Sugars.
sugars, soft drinks, and the very well known roti, for example.
Sore topic for me, boys. Sore topic for me.
Exactly, yes. The roti that is the main ingredient is carbohydrates. Um, then if we don't remove this biofilm constantly, if we don't practice good oral hygiene, or even, yes, we can go and brush our teeth, but not in a right way, not spending enough time. It's just like playing with the toothbrush and that's it, pretending that we practice that we brush our teeth. Then that dental plaque will remain uh, over the teeth surfaces, not even at the front or at the back, but even in between. That is why it is important, as we talk one time, to floss our teeth.
Yes.
Then remember that the steps are first
Floss,
floss,
brush,
then brush, and then use
rinse,
the mouthwash.
mouthwash.
But if we don't do this constantly or in a proper way, then that dental plaque will be colonized by bacteria. Bacteria will start growing over, and the chemicals that these bacteria will produce will damage directly the gum. Once the gum is damaged, the first sign is the inflammation of the gum. So the pink color that we can see on our gums will turn to be red.
That's the physical change we're
The
gonna see.
physical changes once the dental plaque grow enough with plenty bacteria over, that the first changes that we will see is that the tip of our gum in between the teeth will turn to be red and not pink anymore, and will this gum will grow a little bit, which is a sign of inflammation. The next thing that will happen is that we will notice that when we brush, it's easy for this gum to bleed, even um,
A soft bristle.
it's a soft bristle and not so hard contact over the gum. Even when we are talking, we will notice that the gums are bleeding. So because that is a stage of severe inflammation of the gum. So this is the first stage in this type of gum diseases, the inflammation of the gum, that we call that gingivitis, that condition. So we can see here on the screen on the left we can see a normal gum that is colonized by bacteria that normally live in our mouth that we call symbiotic microbiota, and the gum is pink and there is no sign of inflammation. However, when we allow this dental plaque to grow, then the dental plaque will be colonized by bacteria that will be causing this gum disease at the beginning, which is the one that I call as gingivitis.
Yeah, yeah.
Okay, that is the image that we can see on the right hand side on the screen.
The dysbiotic
The dysbiotic microbiota is when this type of bacteria
yeah.
are growing because we are giving them
feeding them
with this type of having keeping the dental plaque over our teeth, not brushing enough time, or skipping the brushing times that we need to do as normal. So on the second image we can see on the bottom what is a normal gingiva or gum. You see that the structure is pink and smooth, and on top of the teeth the structure will be like an orange skin with some fine points, but everything is pink as the viewers can see. However, on top of the image what we can see is an acute gingivitis on top, in which the tips of each gum that is between the teeth is red and is swollen, so the shape that we can see on bottom is no longer there on the image on top. And in this stage it's easy for this gum to bleed, not even by brushing, but when we are talking, when the air touches the gum, when the lips move over the gum, that can cause for the gum to be bleeding. So what we can see here is an acute gingivitis, which is the first stage in this type of gum disease. If this process continues, then the inflammation can reach into the bone, because we need to remember that the structure that is holding the teeth is the bone, and the gum is just sealing everything.
Yeah.
Okay?
Yeah.
So if that inflammation remains, if the person that is suffering this type of condition is not taking attention as soon as possible, and the person don't pay attention to this, because the funny thing is that apart from all this bleeding and inflammation and so, it's a painless process.
Oh, so you don't even know you have it.
You will notice that,
but you'll notice it physically, but you don't feel pain or anything like that.
Bleeding. You will notice that your breath is not fresh. You will have like a bad breath, and so you will notice sometimes changes on the taste of your mouth, but it's not really painful. And once there is no pain, people don't pay attention to this. But in that case, it's something bad, because if you don't pay attention to this type of disease, then the inflammation will progress, reaching into the bone, and once reaching to the bone, then the problems will start, because the bone will change the level, the bone will go up, and the bone that you lost, that the body cannot recover that bone. So once that bone is lost, then the teeth will start getting shaken and will be rotating, changing the position. And if the disease progress a little bit more, then the person can lose the tooth. And we have some more images here that I will share just now. Like for example, in this picture here, we can see right on the left hand side what is a healthy gum. That when we introduce an instrument that we call periodontal proof, the the space that is occupied for the gum is like 2 millimeters. So the instrument will reach just as deep as 2 millimeters,
Oh, okay.
which is an indication of
Healthy gum.
healthy gum. Okay, but once the gum get inflamed because the gum grow as a consequence of the inflammation, then that measurement will be no longer 2 millimeters, will be more than 2 millimeters, which is an indication of this type of inflammation. And if the patient is not getting attention as soon as possible, if there is no professional intervention, then the bone, which is under the gum, will be, uh, as a consequence of the inflammation, will be changing the level. We say that the bone is losing the bone, and then that measurement will increase from 2 millimeters going up till 6 or 7 millimeters. Once you have, like for example, 12 millimeters, that means that more than the half of the root is out of the socket that is holding the tooth, and then in that type of cases, the tooth will be even movable, shaking, and will be rotating, changing the position. So people will notice that sometimes if this type of process is too advanced, the frontal teeth will move forward. Okay, so the molars, for example, the molars will start rotating. Okay, so the occlusion will not be balanced anymore once the disease reach to be a periodontitis, which is the stage in which the what was a gingivitis at the beginning is damaging the bone then. So checking the next set of images, what we can see here on top on the left is, as I say, the normal gum. Then on the next image on the right hand side is a mild gingivitis that the arrows are pointing all over the gum, showing how inflamed and red the gums are. Okay, the main reason for this is, for example, that the person is not brushing properly, that there is dental plaque over the teeth surfaces, causing this type of inflammation. Okay, so if in this point the person is not uh, getting finding any type of dental attention, then the disease will progress into the bone, and we call that, in that stage, we call that periodontitis. So it's no longer a gingivitis, but a periodontitis,
Which
and
is which is
which is
worse.
which is worse. Is worse. So in this point, I will make a little stop here, and you can ask me some questions also.
My grandmother, when I was growing up, and you know you're talking about this, it kind of jolted my memory. I haven't remembered this incident maybe for 4 decades or so, but I remember when she was saying something, and then she had dentures from the time I knew her. So she would have probably had dentures in her 40s, I guess. Um, and I remember she saying that in a very early stage in her life, early age, she remembered that I remember her saying this, that she had an issue where there was massive inflammation in the gum, and the teeth were coming out. Now we have to remember this: these people were in the, before the 50s and all that. They were, my grandmother probably born in the 20s or 30s, something like that. 20s, I think. 1920s. And so there would not have been much oral, understanding of oral hygiene, and the things were not readily available. I remember when I was young, growing up, a lot of people were brushing their teeth with a piece of stick, a thing called black sage. Have you heard of that? You ever try it?
Not really.
You gotta try the thing, buddy.
But is available in Guyana
Yeah.
at the market or
No,
so?
no, you don't get anything for buy. You got, when you're walking on the road, if you know black sage, you got to break off a piece. But here what happen? A day when you come by me, they got black sage around there. We're gonna break off a piece of this black sage. We do cut the black sage out like about 6 to 7 inches. You pound the edge,
Uh-huh.
so it becomes like a little bristle.
Like, oh.
And the black sage has a nice taste, and I believe it has some sort of properties that can kill bacteria and so on, because that is what people used to use back in the days. Yes.
Oh, well, that is very much interesting, man. I want to try that.
Yeah, yeah. Here, if you brush your teeth with black sage, you start brushing teeth with toothbrush. So it can be floss, black sage,
Let's say.
and then rinse with
rinse.
mouthwash. But it's interesting that you don't know this. But don't worry, I'll make sure that the next time you're there, there is some place right in there that has I've seen it a couple of times. But obviously things would have progressed, and now there's toothbrush and so on, so you don't need black sage anymore. But they long ago, what happened? People didn't have the type of care and that sort of stuff. But I remember going back to the point with her is that she did mention to me that there was some inflammation, and she kept losing her teeth. Now that you're talking about this, I realize that this would have been the issue that she would have had at an early stage, because the care was not there, and the education was not there, and the products perhaps to do proper dental care and so on would not have been there. That is why a lot of people in there, would have been having dentures at an early stage. So a lot of people would have gone through this, and I know this for a fact because, as I said, she would have gone through this. As I said, a lot of young people back, when I was a kid growing up, I remember a lot of young people would have dentures, and it may have been that a few things like cavities and so on, but this could have been one of the things, because I remember clearly, distinctively, she telling me that that she had inflammation of the gum, and she couldn't chew, or she couldn't eat the teeth. When she would chew, it used to move.
Yes.
That is what happens, right?
That is in that case, she passed the stage of gingivitis and reached into the periodontitis, in which the bone is inflamed, and the bone is losing the level. So as a consequence, the teeth start getting shaken, and the teeth can move. And in a point, as I will show on this race, the tooth will stay in the mouth just because it's attached to the gum.
Okay.
But not longer to the bone.
Right. So you can
move that tooth with your finger.
So
And
you can't eat properly with that, because
you cannot eat properly because it's painful, it's bleeding, sometimes pus is coming out. The tooth is just attached to the gum, but not to the bone.
You're telling me this. I wish Grandma knew this such a long time ago, because obviously she didn't sign up for that. She wanted to keep her teeth and everything like that, but because things were not available, information was not available, she would not have known. And that is why this program is so important, because not because it didn't happen then, it can happen now. It still can happen now or anytime in the future, if you don't take proper care of your teeth and have proper overall oral hygiene. And what is even more important is that having this information at hand, meaning that you can act on it.
Exactly.
You can act on it, because you notice lots of you. I mean, folks, if you're watching this program and any of these symptoms you're having, understand that it's not just cavities or these things can make you lose your teeth. As a matter of fact, if you have gingivitis, you can lose all of your teeth. Because and what is the natural progression of this? How long does it take?
It's taking a little bit of time.
So you have time to
Yes.
fix the problem.
You have time. For the disease to progress takes time, and there are some factors that will accelerate the process or will keep the process a little bit slow. I will speak about those factors later on, but you have time. The person that is suffering this type of disease, they have time to go and seek for medical attention and treat the disease and stop the disease. Okay, so it's not that they don't have resources, and as you get the attention earlier, will be much better, because it's not so costly to, for example, do cleaning, deep cleaning, uh, give to the patient some medications that is not so costly, other than remove a tooth, replace that tooth with implants, treat some pockets by using bone grafting and so, with some kind of, let's go to say, fancy medications and techniques that are making the treatment costly. So if you get the attention at an early stage, the cost for you will not be so high.
All right, great. Later on in the program, I have two questions coming in, and I would want you to answer them for me. So we're gonna, at about just about 10 minutes before the program time, we're gonna deal with those questions. I want to say good night to Savitri Siokinandan, watching out of Toronto, Canada. Good night, Sharmila and Carmen Narayan. Carbo, we're gonna deal with the question a little later in the program. Um, this every week we have this program. It's something different, it's something new, and it's always something that I never considered that can be so severe that you're realizing that it can be this bad. Can I remember I asked you one time if bad teeth can lead to someone being dead, and then we went through the scenario that the bacteria can travel down and go and get to the heart and infiltrate your body, and it can cause some problems. This look bad.
Yes, because imagine that the bacteria are right there,
Yeah,
mixed with your
blood vessels
with
and all
the
of
blood
that.
vessels and so. So this type of condition can um, go and end up in a bacteremia, which is bacteria in your blood actually. So if the person has an immune disease, an immunodeficiency, if the person has some kind of heart malformations, then the process can end up in an endocarditis, a septicemia, and the life of the person can be in danger.
Wow, so it can be fatal. Yeah.
Yes, exactly.
Wow. All right. So good night, Robert. Thanks for joining, Robert Sahadio. So all right, as we go on with the next stages that you have on the clip there.
Yes. So as I say, once the gingivitis is not being treated, then the inflammation will reach into the bone, and the bone will be losing the insertion. The bone will be changing the position, and that bone that is lost, the body will never recover back that bone. So once the bone change the position and it goes down, then people will notice, as the image is showing on the bottom part of the screen, that the actual crown of the tooth is getting longer, and it's because the gum is receding, following the receding process of the bone. So once this situation happens, as the viewers can see here, the crown is looking longer, and then the teeth can start moving from the original position. Some teeth will go down, some other teeth will move forward, some teeth will move inside, some other tooth will rotate. Okay,
Yeah.
so this is the situation here
Okay.
that we can see here. Like for example, in this image, this person, this is a picture of the same person. How the person didn't take care in this stage in which the person is um, suffering a periodontitis.
One minute, operator Andre. I'm not. Is this up on the screen? Yeah.
So yes, the the viewers can see here. This is the same person. How the disease is progressing into be worse if you don't get attention. The the image on the right was an stage of the disease, and in the image on the left, so you can you can see how the disease is turning to be worse.
Yeah. Yeah.
Okay, the teeth position, the level of the gum is changing, discovering more to the structure. The crowns are turning long, and the teeth are changing the position. So let me see here, one X-ray. Yes. In this panoramic X-ray here, we can see the actual situation of the bone. As I was telling you, we can see here, for example, how in this molar here is out of the bone. There is no bone holding this molar. This set of molars here are uh, staying in the mouth because are attached to the gum, but no longer to the bone. So this is the type of situation in which the patient can move the tooth with their fingers. Okay. Also here, you can see that the molars are no longer attached to the bone. So these molars are staying in the mouth just because they are attached to the gum, but there is no bone holding the molars. And as a consequence, you can see how this molar is down into this space here, and this molar is going up because the teeth are now free to move once there is no bone attaching the teeth. Of course, that once the disease reach into this stage, this stage is a severe periodontitis, it's impossible to fix back these molars or these teeth. These teeth you have to remove the teeth, clean out the bone, and then offer to the patient a solution to replace the teeth, maybe by using implants or dentures if the level of the bone is too low. So you can. So what I am, the message that I want to give to our viewers is that once you um, get to see that your gums are bleeding, that something is not really well, you have to get professional attention. Because if you allow the time to pass, this is a process that when it's at the very beginning is not painful. The only thing that you can see is the bleeding gums. If the person allow the time to pass, then will be too late to save the teeth that are damaged by this type of periodontal disease.
Wow. This it's mind-boggling how the body can react to disease. You know, and it's not just for oral health and issues with teeth, but the body really does react in its own defensive ways to prevent itself from having.
And also, sorry to cut you because this is important.
Yeah.
The progression of the disease. The disease can progress slowly or faster depending on some conditions. Like for example, if the person is under a lot of stress, the stress is releasing some hormones in our
Bodies, yeah.
in our body, and that hormones will increase, will increase the blood circulation, increasing the bleeding, increasing the inflammation, and accelerating the process. If the person, for example, is and a smoker is having a smoking habit, then that smoking habit, the nicotine and all the set of chemicals that are releasing into the body because of this smoking habit will decrease the capacity of the body to defend against this type of disease. So all those people that are smokers um,
At risk.
are in risk of for the disease to go faster than those that are not practicing this type of smoking habit. Also, for example, during the the period of time in which the teenagers, the age of the adolescents, then this disease is more frequent because the hormones that are circulating at that age will increase the blood circulation around the gum. When the women are during the
Cycle.
the menstruation, also the disease can appear because of the hormones that are circulating. So it's a set of conditions that can increase or decrease. Also during the pregnancy
Exactly.
period.
I was going to ask you that because I now remember a lot of women have issues with their teeth and certain problems
With the
during pregnancy.
gingivitis, yes,
Yeah,
because of the hormones.
yeah.
So that is why during this period of time, during this type of conditions, you have to increase the way that you are brushing your teeth, how you take care of your teeth, the time that you are spending brushing your teeth and so on.
Wow.
Okay, or also visiting more frequently your dentist for checkup and so.
Interesting. Um, so gingivitis, it's here why it's a touchy subject a lot of times. Your friend, your co-worker, your family member, your girlfriend, your boyfriend, whoever, they have not fresh breath. Perhaps it's a bit foul and sometimes downright bad. And that's why we have this platform, because we talk about things. We're not here to sugarcoat nothing. As a matter of fact, we do not propagate sugar coating in any way, because sugar damages teeth. If you leave a coat of sugar in your teeth, it gets damaged. So just to say that we talk it plain as it is, and somebody has bad smelling breath, but it's a sore topic for somebody to go tell. You say, man, me want to tell the man nothing because, but you're telling somebody else now for tell he, because you believe that person may feel bad about it, or they're gonna think that the first thing they can say, man, like when they feel bad, they're gonna say, well, why you gotta tell me this, like somebody have to say it. And I believe the best persons to say that are the people close to you in your homes. If there is an issue, they have to say to you, look, there's an issue and you need to have this sorted out, because it does not only affect the person that is having the condition, it affects the persons around you, because they're not comfortable around you. You're going out Valentine yesterday. We do.
Yes, I spend my Valentine quiet.
Okay. I went home, I work, and I made some tea, and I lit the candle and I drank some tea by myself. I like tea. Valentine's Day, you're going out with your girlfriend and your boyfriend, something like that, and they're you're having this conversation and about love and all of that, but it's uncomfortable because the while the ambiance is right, the
Something is going wrong.
something is not right. And I said it's a sore topic to talk about, but these are things that has to be spoken about, because somebody has to talk about it and it has to be fixed. In your training, becoming a dentist, and in all your years of training and becoming who you are now, are these topics that people will talk about in training, as to how, in the psychological way, how you can get people to talk about these things and how to deal with them?
But usually patients are coming uh, to the dental office to say, okay, I noticed that
When it gone bad.
yes, my breath is not right.
Yeah.
I notice a taste mostly in the morning and so on. So the dentist has to go and check, because like for example, the bad breath is a sign of something that is not going. But the bad breath is not a disease per
Yeah,
se.
yeah, that's right.
It's a sign that something is not going
Something is off.
right. So you have to check first of all the teeth condition, if there is any cavity. If you have plenty cavities, for example, with food inside and dental plaque, of course, bacteria are living there, producing all type of chemicals and gases and so that can be a cause of bad breath. And then how what we will do is to fix that, so the bad breath will disappear. But also these type of diseases, the periodontitis, the gingivitis will be causing bad breath because of the same situation. Bacteria are living there, are having a great time living in those places. And the next cause of bad breath is the patient is not suffering a huge amount of dental cavities. If the patient is not suffering gingivitis or periodontitis, then you have to check the throat, the lungs, the stomach, or even some kind of diseases that are in the blood will cause bad breath. So you have to have a general vision of this particular issue. But usually, when the cause is coming from the mouth, it's related mostly with gingivitis and periodontitis, because as the picture you can see the picture, how the pictures are showing how bad the gums will turn if the person is not taking care the the gums.
Okay. So, all right, good. So that's from your perspective, right? But why was asking? No, instead of me going up to somebody and saying, "Man, I think you got a problem," and this is the to be honest, I did it recently with somebody, right? A young man, and it was a little bit overbearing. So I called him to the side and I said to him, I said, "Man, listen, I got something to talk to you about. I don't want you to feel anyway. I like a big brother to you. Just put it like that. But I know you're a young man, you're out there, and you're talking to a lot of young ladies and so on. And when you talk to these young ladies, such and such can be a turn off to them. And I believe you have an issue." Now, whether I don't know if he took umbrage to it and was mad at me for it, but I said it to him. Immediately, what he did, though, he recognized that there was a problem because I told him about it, and he took steps to fix the problem. So a lot of times when we assuming that people gonna feel bad if we tell them, honestly, they'll be glad if you tell them. Me, I glad somebody you come and tell me. I know right away. I know I got a problem. I go and fix my problem. I go and fix my problem. So what I was asking, are they in your training? Are they
Any way
is there any way you can
how to approach
how you can approach people, the people that and not for you to approach them as your dentist, because as you obviously say, when they come to you is when both in Ghana we got saying both gone files already, you know what I mean? When they both ready for go over the files, you can't change the title or not like that. It's going down. So but is there any way in which, are there ways in which, or people can go, or can they go online and check this up and like
but,
psych, little
as you say, the person close. Of course, a stranger cannot come and tell you, okay, you are having this type of issue, because it's really uncomfortable. But the person close to that person, a family, a friend, a co-worker, that are really close, that they have enough confidence to bring that topic, they can approach the person that is suffering from bad breath and tell them, okay, I think that you're having this issue, and maybe give them a little advice about, that you have to consult, go, or I know this doctor, they call him, go and check. Okay, so like for example, the viewers that are seeing this program now, they can say, okay, the bad breath can come from the gum, can come from the cavities, can come from the throat. So now they know
that
is why we are doing this, to give information. Now they know that maybe you will need to see the dentist, or maybe you will need to see a general internal medicine doctor, and so to find out what is the cause of the bad breath. Okay, so we are focusing on this topic about the bad breath, but the person can approach any other person suffering from this type of issues in that way. Okay, giving a little advice about what to do.
All right. So now that we're talking about what to do, let's talk solution now. We have about 15 minutes more to go on the program, and we're gonna leave about 5 minutes. I have 2 questions to ask you, but let's talk solution.
The solution, okay. As I say every program to all our viewers, the prevention is the key.
Yeah.
To not to cure any disease. So once we practice good oral hygiene, once we practice a good habits, a good diet, I think that you have a program about that. How to
yes,
practice,
indeed. Yeah.
How to practice good diet, good habits. Once we brush our teeth
4 times a day at least.
4 times a day at least, spending 5 minutes is not one time like playing with the brush and soap. Spending 5 minutes, taking the time, flossing, not every day, but at least any other day, using our mouthwash, changing our toothbrushes every 3 months, or depending of how they are looking. Um, that is the prevention of this type of diseases. Once the disease is there, you have to go and get professional attention. Maybe the doctor will do a cleaning and will send some medications to kill bacteria, some antibiotics, and some type of medicated mouthwash, and that will solve the problem if in the stage of the gingivitis. But if the disease reach into periodontitis, which is damaging the bone, then the solution will be different. The doctor will need to do a type of surgery that in which the doctor, after treating the gingivitis first, and once the gums are not longer bleeding, the doctor will need to do a deep scaling, deep scaling of the teeth, meaning opening the gum by a surgical way, of course, and clean the tartar that will be under that gum, because the patient will be having periodontal pockets. Periodontal pockets are spaces that are created once the bone move into a next position, leaving an space for food to go in, for tartar to stay there. So the doctor will need to do this type of procedure, okay, to clean up under the gum, deposit some medication, and stitch back. So that is a solution. Or even if the disease is too advanced, go into a next step, which is removing those teeth that are not longer attached to the bone, that are just attached to the gum, removing those type of teeth with that condition, clean up the rest of the teeth that can be saved, and take stitches, and then later on, once everything is healed, then start speaking with the patient about the solution, about how to replace those missing teeth.
Brilliant. So, Kamo Narayan, I know that was one of the questions that you had asked. So, I hope that answered your question, Kamo. One of our top fans, he's out of Berbice, he always watches the show, and he's always interested in what we have here. I want to say goodnight to Kevin Jagdeo. He's out of Berbice in New Amsterdam. He's always watching the show, and he's one of our top fans. And one of our top fans, Arjun Jawahir, is joining us also. Since we've started this show, Arjun has been watching with us all the time. So Kevin messaged, and he said he had a problem, and it's not related to what we're talking about tonight. But of course, we're not going to miss the opportunity to help to give advice to anyone who has an issue, whether it's related to what we're dealing with or not. Kevin has a wisdom tooth that is growing in the back, and it's protruding, and it's kind of hitting the gum at the back, at the back on the bottom, and it's very painful. What should Kevin do?
So that condition is called pericoronaritis. It's the inflammation of the flesh that is covering the tooth. Since you have in there a space of a tooth that is trying to go out, but there is not a space, the food can go underneath. As again, the bacteria are feeding, that food is feeding bacteria. The bacteria are growing, producing the chemicals that we talk about, and those chemicals will inflame the gum. Once the gum is inflamed, then this condition will appear, the pericoronaritis.
I think what happened with him, Kevin, is still, people get wisdom tooth very late. Some people get it very late. So I think it's still growing. And as it's growing, it's that space that was there, it's protruding now, and it's kind of hitting the
tooth that is opposite is
yeah.
So what the person has to do, use some plenty mouthwash to keep that area clean, and of course get dental attention as soon as possible. You have to go into the closer dental clinic to get some X-ray done and get some advice about what has to be done. Okay, probably the extraction is needed.
Perhaps since he's a top fan of ours, we should have him. Kevin, if you're watching right now when you're coming down, just I'll send you Dr. Pico's number. You can have a chat. Just stop in. He will he'll check you out, do a free consultation for you. So we have here Jiwan Singh. Good night. He's saying good night. He's a practicing dentist in New York, and he's saying thanks for the great advice to our people and making them aware of the importance of oral health. Jiwan, thanks for having you with us too, also being a dentist. Jiwan, I'm going to throw this out to you right now. If you come to Guyana anytime, I would love to have you on the show. You can always, you see the numbers at the bottom on the screen there, the WhatsApp and so on. You can WhatsApp one of those numbers. You can get my number from Dr. Pico, and you can let us know, and we will be sure. I'll be glad to have you on the show. We're going to talk about oral care and dentistry in New York and what's happening here too. So if you have it here in Guyana, be sure to hit me up and let's do this.
That would be so nice.
Yeah. So Kevin, if you come down and you go to Dr. Pico, he'll be sure to help you out. And so he said yes. So he's watching, right? Yeah. And I have my Kevin is the father of my godson, Jonathan. So perhaps if you bring Jonathan, you just check him out for me too, yeah?
No problem.
Brilliant. I'm pouring it on you tonight. Camo Narayan is saying thanks for the advice. So Camo, the office is located in Cummings Lodge on the railway embankment. It's 3 buildings off UG Road if you're going in the direction of Industry or Mahika. It's a huge 3-story gray building, and there's a massive sign in front that says Innovative Dental Care. Good night, Amar Prasad. I see you're late and it's really interesting. You can watch back this show. It will be up on the Guyanese Critic page and on Facebook page and on YouTube. So you can watch the show there also. So and if there are any other questions, guys, now is the time. Just let us know. You can ask anything about dentistry or about oral hygiene, or if you want to have implants or you want to have something done, just let us know what is we have. There are different types of cleaning. You want to remind the viewers of the different types of cleaning that you do right now?
Yes, the type of cleanings are the standard cleaning, then a standard cleaning with fluoride application, a jet cleaning, and jet cleaning with fluoride application. So those are the type of cleaning that we are offering over Innovative Dental Care office.
Wow. As we wait on the questions to come in, you've been here for what? Have you ever heard of this name, Dave Martins, and the Trade Winds, the music?
No, not really.
So he sings some really nice kind of music. It's really Caribbean, but he's Guyanese, and he's legendary all over the world. He's iconic and he's legendary, and he's going to be in the studio tonight, and he'll be sitting right where you're sitting. You know that? Yeah. So after one famous man and an even more famous one will be coming in here this evening. I'm going to share some of Dave Martin's music with you. It's uniquely Guyanese, and as we're getting closer to the Mashomani season, which is Mash is next week Thursday. I hope maybe you could do costume next week Wednesday. You could do some carnival costume on the show next week. But it's I keep telling people it's so Mr. Jiwan Singh, who is the dentist from New York, he says certainly it will be his pleasure. We're looking forward to having you, sir. I keep telling people, Pico, and this is it's an amazing time to be Guyanese be Guyanese. It's a wonderful time to be Guyanese. The country's on this drive, and everywhere you go, you see there's development happening here, and there's development happening there, and so much of infrastructural work. They're gonna be building a new bridge across the Demerara River. So hopefully I don't have to leave at 6:05 in the morning to get to work for 9 o'clock. So I reach to work by 6:30 in Georgetown. But I do that to avoid. But I say all of this to say that, with all of this that's going on, we need to take care of ourselves too.
Excellent.
If we're going to be the face of the new Guyana, then we ought to be the smile of the new Guyana too.
Exactly.
When people come into this country to smile, They must say, these people have good dental care because everybody has nice teeth, nice bright smile. Unless everybody has no teeth and say, man, wait, something is really lacking here. What is happening here? So as we move forward into the next phase of what this country is going to be, and you've been here for a while, you see what's happening right now. Great things are
Yes.
happening.
The Guyana I found when I reached, that I was so scared of that airport. It's not the same Guyana. It's not the same Guyana. Guyana is changing for good.
let me
For
remind
good.
let me remind you all about something. So Pico come in the country 2015.
2015.
Yeah.
Yes.
So
December 2015.
December, because I driving from the airport coming down, so you see a couple of lights and so on. Then all of a sudden the whole place black, no light. Right through coming down from the airport is sheer bush. So Pico says, where I put myself in here is where I really go in here now to practice dentistry. Man, I said, wait, you used to live there, got people for look after teeth because you ain't seen
Nothing. Just
nothing. Sheer darkness right through. You see the river, Demerara River. Because when you reach in Main Street and you see the lights on the trees and so on, you might say, wow, civilization. But Ghana is so big, it's so vast. And what happens is that we have central, people are in central areas, like Georgetown, and then you have different villages on these banks and so on, and they're more off the main road, so you would not have seen them. But it's good that you're saying is the Guyana that you saw then.
is totally different than this new Guyana. So and will be much better.
Yeah. Well, Dr. Pico, it's always a pleasure having you here. As we come close to program time, we have about 2 minutes more to go. What is it that you would like to add? And
Yes,
looking back at the last, weeks we've had.
As we all the time say, people have everybody has to take care of themselves, practice good oral hygiene, good diet, good habits. So and check themselves, learn to know what is right, what is wrong, and checking that the person can go and seek for professional attention. As you say all the time, not in my office, but in any other office in the normal places that they feel comfortable to go. But just don't hesitate. The person cannot be waiting, hoping that this will disappear, or maybe later, or I will gargle with some salt water and so. Once the person see that anything is wrong, anything is not right, the person has to go and get professional attention to avoid any future consequence. That, as we always say, the prevention is better than cure, and is far away less expensive. So that will be the best, my best advice every single day that I am coming here.
Fantastic. Yeah, I always believe in that too. If you can prevent something from happening, you prevent it because, I usually say to people, I said, you don't know how sick you are until you become sick one day. So keep your body healthy. Eat the right food. If you're gonna eat and you're gonna have sugary stuff and so on, please ensure you brush afterwards. Please ensure you floss. Please ensure you use a proper mouthwash. And if you're gonna be out late at nights and so on, then make sure. One last thing, you mentioned smoking. So Amar Prasad here, he has a question. Well, not a question. He's saying that thanks, 80% of my teeth are cutting just by the gum line. I usually brush my teeth for a long period unconsciously. Perhaps he's using a very harsh toothbrush and a toothpaste that might not be necessarily be.
Yeah, we need to remember that we need to know how to choose our toothpaste and our toothbrush depending on the condition. Also, how to brush. You cannot brush applying certain movement. You have to brush from the gum to the teeth. Taking time Okay, because if you brush horizontally, for example, just at the front, you will cause for the gum to recede, and once the gum change the position, then some issues will appear, like hypersensitivity because of cervical abrasion and so. So we have a program already about that,
All
so
right.
the
Yeah.
person can go and check or research in YouTube
Yeah,
also
Amar, you could go back and watch some of our shows. Dr. Pico, thank you so much.
about the Colgate and so that we
Oh, yes, about the products that we
the
had up
product
there,
that we
yeah.
have. Mhm.
I see my cousin is joining us very late. Juan Carlos, you can join us you're for joining from Essequibo. You can join us every Wednesday at 6:30, man. Be sure to join us. Um, Dr. Pico, as usual, thanks so much again for being here. It was really a pleasure, and we do this every week. We're gonna continue to do this every week, and we're gonna bring the information to people about proper oral hygiene. Guys,
For sure.
everybody out there, thank you so much for joining us. It really was a pleasure. We learned a lot tonight, and we were able to answer some of your questions. Just remember, every week when we do this, the last 10 to 15 minutes, we are going to take some questions from you, and we're gonna answer the questions, whether it's related to what we're doing or not. So again, guys, thanks so much for joining us. It's always a pleasure. As I said, we're coming live from TBN Studios right here in Queenstown, Georgetown. And I want to say to you, drive carefully out there. Man, it's crazy sometimes on the road. Just watch out for those who are not watching out for you. And as I usually say, ciao for now.